Hello, my name is David Trimberger, and this is my second peer-to-peer attempt for nasotracheal intubation. First thing that I want to do is gather up all of my materials, such as capnography, a suction device, a airway adjunct, lubricant, my ET tube, and a BVM with a mask. First thing that I'm going to do, come over, open up my patient's airway, inspect the airway, inspect their nostrils, see which nostril is the least deviated as well as the biggest. And then I'm going to inspect their airway. If their airway has vomitous secretions or blood, I'm going to insert my suction device, suction for no longer than 10 seconds, only on my way out. Going to come over and make sure that my airway is clear. Going to insert my OPA. Going to come over and ventilate my patient at a rate of 10 to 12 times a minute. I'm also going to put my patient on an SpO2 monitor and attach my BVM to oxygen. Go ahead and put them on a nasal cannula high flow to allow for them to be able to become pre-oxygenated. After I have done all of that, another thing that I'm going to do is get prepared for my intubation attempt. So I will remove my my OPA. I am then going to come back, re-inspect my nostrils, and then I'm going to prepare my ET tube. I'm going to insert my tubing, and then just as I'm about to pass the vocal cords, I'm going to pause, check to make sure that I can hear airway movement, as well as that there's misting in the tubing. Once I have done that, I'm going to instruct my patient. All right, I'm going to try and advance these past your vocal cords, so I'm going to need you to take a big deep breath for me, okay? 1, 2, 3. Wait for that big deep breath. Advance my tubing. Inflate my cuff. Remove the syringe. Take my BVM. Attach it to capnography. Attach it to my patient. And then go ahead and continue to ventilate my patient at a rate of 10 to 12 times a minute, assessing for any signs of hypoxia. I am also going to take my stethoscope, auscultate over both the lungs as well as the epigastrium to assess for, to make sure that I have proper placement. And then once I have proper placement confirmed, I will go ahead and stabilize my tubing, and then continue to ventilate my patient at a rate of 10 to 12 times a minute, assessing for any changes in patient condition as well as SpO2, capnography, hypoxia, and then monitor my patient while en route to the hospital for any change in patient condition. Thank you.